We visited Lynn a lot.
Now, family members only have these pictures to help tell the story of Lynn Lanice. From her stay in a Baltimore County nursing home following a debilitating stroke to their struggle to get her better care. Because of that stroke, Lanice needed help eating, but the family says she wasn't getting it. She lost a lot of weight. It's just one of their many concerns outlined in a complaint they filed with the state.
When you saw your sister in this type of condition, or these types of conditions, what did you think?
It was awkward, it was embarrassing, and she was really starving.
The complaint was filed with the OHCQ, the Maryland Office of Healthcare Quality. The family expected their complaint to be investigated, but say it never was.
I think it's heartbreaking, and I don't understand why.
Irene Dorenzo is another of Lanice's sisters.
It's a breakdown in the system, and it shouldn't be a breakdown in the system.
Mary Beam filed a complaint in April 2021, in the middle of the COVID pandemic. When she didn't hear back, she called OHCQ and was told the agency was overwhelmed.
They have so many complaints. They're inundated because of COVID, and COVID hit hard to our nursing homes and our senior facilities.
Beam kept track of her many calls to OHCQ to find out what happened to that complaint. She was regularly told it was still pending. And in November 2022, a year and a half after first contacting the state, an agency representative pledged to still investigate the complaint, though she couldn't commit to a specific date or time.
If complaints get lost, where's the teeth in the complaint process?
I feel that it's a travesty. It's not right. It should have been taken care of. It's still not taken care of.
We were given a case number within a week of the Office of Healthcare Quality receiving our complaint. Now, what do they do with that log of case numbers? How many other cases never got inspected or never got evaluated?
Individual complaints are often lumped in with an annual survey of a facility. It's federally mandated. But 11 News Investigates could not find any evidence that the Lanice complaint was one of them.
The state did find nutritional deficiencies in regard to another resident in a January 2022 survey. By that time, the nursing home had changed hands. It found the facility failed to ensure that residents dependent on staff for care received assistance with nutrition, and failed to document the amount of assistance provided to the resident each shift. In that survey, the facility responded saying it would coordinate education of nursing staff on identifying residents who require assistance with meals and update the care plan. But doing so was not an admission or agreement with the alleged deficiencies.
So I want to reassure folks, we didn't lose complaints. We're not losing complaints.
We asked the health department's deputy secretary about missing or uninvestigated complaints.
We're logging every single complaint, and we don't believe we've lost any complaints. Now, if we didn't follow up with the family, and if you tell us information, we're happy to see what communication there was and to correct that if there was an issue.
According to its annual report, OHCQ received nearly 4,700 nursing home complaints in the 2023 fiscal year. More than 2,800 were investigated. But what happened to the other 1,800?
There is a little bit of a backlog in terms of the number of complaints. We can't go into the numbers because that's considered part of federal protected information.
And the state tells us some complaints don't require an investigation. As for those annual facility surveys, only 42 of 225 facilities were surveyed in FY 2023. And the agency was short-staffed, with only 64 of 75 surveyor positions filled. The health department says now only a couple of vacancies exist, and it is bringing in more staff.
Additional surveyors and for additional contractors to work through that backlog and get us up to date.
Lanice's family says their sister was moved to a different facility.
And they were wonderful to her.
She passed away soon after. But her sisters still want to know what happened to the complaint. They have concerns for other nursing home residents, and they wonder about their own future.
What's going to happen to me? What's going to happen to my sisters? We think about what happened to my older sister. Can that happen to me? Hopefully not, but something's got to be done to help prevent that.
For 11 News Investigates, I'm Barry Soon.